What's up, everyone? I made it successfully through the surgery. I'm all good. I'm healing up. Thank you for everyone that reached out for the for the kind wishes and everything like that. I really appreciate it. That was really cool. I figured I would go down this journey and kind of express what's going on with me, what was going on. I went through the surgery, and what I'm going to be doing is that on this video, I'll be talking about what happened the day of surgery. And then in future videos, I'll kind of break down like the first week of post surgery and how I've been going through it this last week. It's been a full week of since I've gotten the surgery. It's been 10 days actually. And I really had a hard time trying to like maybe film while I was going through it because it's been a really weird journey so far with ups and downs of pain and how I feel. It's been a weird roller coaster, and but I'm glad to be going through it, getting better. So I just wanted to put that out there so you guys know kind of how to expect it rolling out. And also, if you guys have any questions or anything like that, maybe leave some I know it sounds everyone does it, but put your comments or questions below, and maybe I'll just do a Q&A because I feel like I am missing a lot of parts of like how initially my leg got diagnosed or my hip got diagnosed, and all the whole process of like the years of looking back, slowly noticing how my hip was kind of like deteriorating, I guess you would say. Leave some questions if you have any below, and maybe I'll do a video just solely on just like those questions, and I can put it out there for anyone that has any questions or whatever. So that last video I did was the night before surgery. That next morning, I slept for maybe like 4 hours. I had to get up super early. I Ubered over to Beverly Hills for the surgery. That's where the surgery was. And I met my mom there, and that was awesome. Amazing. My mom drove up super early. She must have left here at like 3:30 or so. Met me there around 5:30. And it was, going into it, you're just nervous because it's just a big operation, and that was my perspective. I was super nervous. I was really glad to have my mom there to talk to somebody. I suggest if you have someone to go with, definitely go with someone just to talk, and it kind of eases your anxiety, I guess you would say. So I went there with my mom, and it was interesting because you go to like the fourth floor, and it was like a kiosk that you checked into. And I've had surgery probably for like 6 years. So I guess this is something that some places just integrated into their way they work. But I checked in through the kiosk and all these things. I had to pay about almost $7,000 for the surgery at the kiosk. So that was interesting. Did that. I waited there for a while, then someone came out and was like, hey, like, it was actually, I've never had this happen. They're like, hey, so just clarifying, you're Kelly Michael Hart? And I was like, yep. They're like, okay, we're just making sure, and you're getting left hip surgery? I was like, yep. So like, we're just making sure because we have someone else here that has the last name Hart as well. And I was like, oh, yeah, don't mix me up with that person, please. Don't mix me up with anybody. So anyways, got that clarified, went in, and I went in by myself. They put me in, full on. I had like my own little section, the curtain, and they kind of come in there, and they're like, all right, well, what we're going to do is you're going to kind of basically take off all your stuff, your clothes, and you're going to put it into these bags. These are yours. I also suggest while I'm doing this, don't bring anything with you to the surgery unless don't bring any laptops or anything like that. Anything important on that level. I would just bring your wallet, your phone, just like necessities of where you would just need to go for a day-to-day type thing. Some comfy clothes. And I put my stuff in these the bags, pretty much fully got everything off, and then you get into a gown. And you wear these little socks, so they give you these socks with like grip on it, so you can like walk around just to grab, like if you need to go to the restroom or something, stuff like that. So and they make you add before you do that. They give you these wipes, and you fully wipe down your body. Just clean everything. Just make sure. Also, a thing they do, but they tell you to do beforehand. You have to get a thing called Hebe cleanse, and you have to wash your body, especially the part where you're getting the surgery. So they make sure the days before you are cleaning the parts of the body with this Hebe cleanse, which is like really like powerful soap that kind of makes sure it's all clean and everything. So anyways, get all that done, get in my gown. The doctor comes in, or not a doctor. Someone comes, the nurse comes in and was like, we're gonna do the vitals. So the vitals are all good. Then they come in and kind of tell me what the process is. I haven't seen the doctor yet. And they kind of, another doctor comes in and was like, hey, so this is the process. So basically we're going to give you, I took some Tylenol and some other like pills just to like, whatever, just to swelling or whatever, just, I don't know, whatever it was. And then they're like, we're going to give you some medicine going into it. So you're like a little calmer. So that kind of made me feel a little better because I'm like super anxious at this moment. Real anxiety of just that stuff, they put the IV in me. So they give me some medicine and I'm kind of relaxed. Like we're going to take you in to the surgery room and then we're going to give you a spinal, block, which is basically they inject some, spinal block into your back injection. And it makes it so like basically the lower half of your body, like you can't feel it. So that was like, I'm always like, geez, all right. So I'm going to willingly kind of go into this and be like, all right, cool. So I'm not going to be able to feel the lower part of my body. And then they're going to put like a mask on me. And I think, I can't remember if it was like oxygen or whatever it was, but I remember, so doing that, you had to like kind of, all right, hunch over real quick, a little bit on the side of the table. They inject it, and then really quick, you feel the whole stuff working, and you're like, your legs just go completely numb, and you're like kind of can move them. And you're like, whoa, trying to like, and then you have to like, all right, cool. You have to put your legs up onto the table. You lay down, and at this point, I'm like, they tried putting the mask on me and the mask was a little off. I was like, oh no, hey, the mask is kind of off. Let me fix it. And then next thing you know, I just wake up. I just wake up and they're rolling me out of the surgery. I guess the surgery took about 2 hours. And they're walking, they're walking me out in the bed to my little like zone where I'm kind of be resting for a while. And they're like, you did great, blah, blah, blah. Like, I'm like, all right. And I'm so out of it, but like, not like, I'm just waking up and kind of confused. I'm not like extremely drowsy. I'm just really confused of like, kind of, that was it. That's just what happened. What's going on? You kind of forget, at that moment. And then, I will say that anyone that knows me or like just throughout the years of skateboarding and whatnot, I do have really like lower back problems, and well, it'll get, shout out to Shanies and Gwenny, like he'd call me a leprechaun, he would call it, but which I don't know why. Shani has a very funny way of just saying like giving funny like nicknames to people for some funny reasons, but basically like I would have, my back would be like messed up and I couldn't really stand up straight, so I'd be hunched over and it'd be in crazy pain. I had this off and on for years. And still to this day, since I was like maybe 11, I think it might have started. And I just never know when it's going to happen. But anyway, I think since they gave me that injection in the lower back and they kind of, or the way they position you when they're doing the surgery, I don't remember because I was asleep, but I had the incision on like kind of like the back side of like my left butt cheek basically. And it's like, kind of on the side of it. In my next video, I'll show kind of what everything looks like back there. It won't be like too graphic. It just looks crazy because all the bruising is crazy looking. But yeah, they position you kind of, I think, on your side for the most part, so they can kind of like, they do a little incision. Dude, the incision is like tiny. Like considering you're replacing your full hip. It's like, I want to say it's like that big. And they position you on your side. Um, and they kind of do the surgery just like that. And I think when I called the doctor maybe a day or two later, I talked to the PA on the phone. She was like, "Hey, you did great. You were super tense and like stiff when you were doing the surgery." And I guess that's like not normal because people were like really relaxed. But I could kind of sense that because I have crazy lower back problems, and I think like my glutes are. I've always heard this too, that I need to like strengthen my glutes because they're super tight. And man, when I got, so they told me I was super tense. And then why I'm saying this is because when I woke up from that surgery, I was like confused, but immediately, I don't know if this is a problem with other people getting this surgery, but my lower back was in pain. Like, not like it usually is where I'm like struggling like to walk. It was just more like constant pain in my lower back across like both sides, not just one side or the left side or right side. It was both sides. And I was like, oh my God, this is insane. Please, like, I need something. I couldn't, it was like unbearable. And so they gave me some pain meds and that easily kind of chilled out. But the pain that it kept going was on the left side where the incision was. And that makes sense. But I kind of chilled out and I got able to put like a pillow between my legs and lay down on my right side. And I got to relax like that. And I was like, oh, it was like relieving to have that pressure off the left side. And that felt really, really like, that was comforting to know that like I wasn't just going to be sitting there in pain the whole time while I was recovering. And it was cool. Like my mom came in quickly after, she's a nurse too. And also my mom, like it's perfect to have her helping me out with all this. So she really was like, kind of understood this process of how to deal with things after. And so I kind of sat there hanging out with her. They came in and just making sure everything was all good. I didn't see the doctor. Okay, sorry. I forgot this part. I'm going to be all over the place, but try not to be too much. But I did see the surgeon, Dr. Pennenberg, before the surgery. He came in real quick. And it's amazing when going into surgery, how calm the doctors can be to calm you down. Because I'm super anxious in there. I'm like, oh my God, this is crazy. But the doctor's like, hey, dude, like, and I should have known this, and I do know this because my dad's an ER doctor, my mom's a nurse. All my family is like in this like I feel like a high stress zone, but like for most people, but they're so used to it. But they're like, hey, like, as much as you're nervous, we totally understand, but this is like an everyday thing for us. Like we do this all the time, multiple times a day, week, whatever it is. And see how calm he's like, are you ready? And I was like, dude, I've been ready for 10 years, dude. I'm ready for this. And he's like, you're going to do great. Stoked for you, dude. And it was really quick and he went in and I didn't see him even after. But the PAs came in and they were like, dude, you did a great job. Kind of led me through the whole process of what I do to get out of there. But they had me up and walking within like, I would say 2 or 3 hours after I started laying down. And I didn't know, like I've heard that, but then being in that position where my lower back was hurting, I was like, how the hell am I going to walk? This is going to be nuts. So they came in and they gave me a walker and I got on the walker and with the PT, she came in, she was super nice. She was super helpful, but we did little like basically like baby steps of like walking with my, the walker, and it felt wild, but it didn't, it was sore and it hurt in a little way, but it wasn't that bad. Like, it wasn't like, I'm so used to getting surgeries where you're completely out, like ankle surgery, foot surgery. The last hip surgery I had, I couldn't walk at all. I had to have crutches and I had no weight bearing. This is like, you're weight bearing right away. And that's an interesting process. And as much as I was fully active the day before, my hip really hurt, but I could fully, I could jump rope for half an hour if I wanted to. I could run. I'd be sore from the running maybe with my hip, but it was just funny or interesting how you get that surgery real quick and your body just, it's like your muscles are just toast after the surgery. And so my legs were struggling to walk, but it didn't necessarily hurt. It was just really weak. Did that, walked for a little bit back and forth with the walker. I walked up and down stairs. They kind of give you like, hey, walk with your, I believe it was your right foot going up the stairs first. Whatever, I can't remember. I think it was the left going down. Man, I'm butchering this. Maybe I'll have to remember this. I've kind of gotten past that stage where it feels normal now. I'm still on my walker, by the way, but I'll make a video about that later. They kind of gave me the whole process of like how to walk up the stairs, how to walk downstairs. And that was helpful. I don't really have stairs at the house I grew up in, so that's really easy. There's just one step. That's really easy to get up and down, and I hardly have to do it because I'm not leaving this place really. So yeah, that's kind of how that went. And also a thing that the doctor said was, this is the interesting part, and it sounds really crazy almost, but it's something that like just kind of like, they basically said, he's like, all right, well, so we're gonna do the surgery, and just letting you know after you're done, like when you're like back home and you're, starting to walk a lot more and standing up straight, you're going to notice that your left leg is going to be longer than your right leg. I was like, oh, I've heard that. But he's like, but don't worry, that's completely normal. Because basically, think about it. They're replacing your completely worn down hip that has basically shrunken, and you have gotten like almost shorter of the deterioration between those bones and your hip from rubbing it, and all the bone on bone and the labrum been gone. So you've basically gotten shorter. They're going to put you back to your normal height in that leg. I was like, oh, okay, that does make sense. But so it might sound alarming because you're going to be one leg like noticeably like a lot longer than my right, but you kind of, it's like your body does amazing job. Your hip does an amazing job of over time leveling it out. And I thought that it's crazy what the body can do from healing from things. So I thought that was pretty interesting to hear. I definitely, like, I'll show you in the next video, like how different it is. And I'm sorry if I don't get all the information right that I should know that they told me, but I've kind of just been going off of like I said, going up the stairs, whatever felt comfortable to me. I've kind of just done these steps of doing it. But yeah, so that was crazy, knowing about my leg being longer. And then so did the physical therapy. I'm there. I think my surgery technically started around like 7 or so, 7:30 maybe. And we left LA, Beverly Hills around 3:30. And leaving on a Monday or any weekday from 3:30 back to Orange County, that was a hell of a drive. That was 2.5 hours. There's no traffic. Should take 50 minutes to an hour. But yeah, got to chill with my mom. I sat in the car. Luckily, nothing didn't feel too crazy. Got home and ordered some dinner, which was rad. I got the salad I always like getting down the street here at Manja Benny. Love that place. And I basically laid down on the couch, put my leg up, and iced it. Iced my leg, and I took the pain meds for that day because it comes and goes super strong. And so that was what happened the day of the surgery. Like I said, I will make another video to talk about the first week. And I think there were so many crazy things that happened. Not crazy things, but things you just don't anticipate, that they don't tell you, that you hear it's like your surgery is all, since you get the surgery, it's going to be all great and everyone's so much better. But there is these things you have to sacrifice, like the pain you have to go through to get to those moments. And something I was expecting, but I didn't really know how, in which way, and what kind of pain. So I'll talk about that in the next video. And so, yeah, that's it. I want to say thanks again for everyone for the kind words. And hopefully this can give you an idea, if you're going to go through this surgery, that this might give you an idea of how this all goes and what you could look into going into it. Again, I will say having someone there for the surgery, like before and the most important would be after. I could have, like, I mean, I wouldn't want to. I could have gone there by myself and gotten checked in and done the surgery, but like by myself. But after, there's no, dude, I don't even know how anyone would ever do that, is get the surgery and then go home on their own. It just, if you got an Uber, it'd just be chaos. It would be nuts, and you'd make it way too hard. It would be almost impossible. So I will say, if you go through the surgery, make sure you have someone there that you trust, that you're close with, that you could that you could work with on this stuff, because you're gonna need a lot of help. Someone that's willing to like be there for you. And I really appreciate my mom for that. It was like unreal how much like the love and support I got from her, and you guys as well. Although that I do appreciate that. So yeah, that's kind of what happened for me on surgery day. And if you do have any questions, like I said, please leave them below, and I will try to make a video, just a Q&A video of just all these things that I went through. I'm sorry, well, that too, but like all the questions you have had with this surgery. You know, maybe one day I'll do it like with other stuff, like, oh, skateboarding or whatever it is. If anyone even cares to ask questions about stuff like that. But yeah, again, thank you all. I appreciate it. And I hope this serves someone. And if you have questions about certain things that maybe I didn't clarify that well, please hit me up and I can try to help, because I was so lucky to ask people, sorry, my mom was cooking something in the other room. I was so lucky to ask people and get information out of them about how this all went down. So I was really grateful for that. And yeah, hopefully I can help somebody with this. Please, this is a longer video this time, I feel like, but yeah. So thank you very much. Like and subscribe. Just kidding. We'll do all that. I appreciate it. And please feel free to hit me up. And thanks a lot for the love. So I'll see you guys in the next video. Later.